Let's talk about the What Matters Index. More than 30 years ago, community-based primary care clinicians realized that there was a mismatch between what matters to patients and what their clinicians knew about them. Gradually, they developed a simple approach to help get patients and their providers on the same page. Over time, that approach has been refined and adjusted to the What Matters Index. The What Matters Index is based on these 5 questions. During the past 4 weeks, how much have you been bothered by emotional problems, such as feeling anxious, depressed, irritable, or sad? During the past 4 weeks, how much bodily pain have you generally had? How many prescription medicines are you taking more than 3 days a week? Do you think any of your pills are making you sick? How confident are you that you can control and manage most of your health problems? The yellow highlights indicate a positive response. For each answer in the yellow, 1 point is given. This produces a WMI score ranging from 0 to 5. So why should you, as a patient or a provider, consider using the WMI? Well, the good news is administering the WMI takes little time and it has no direct cost. So it puts a low burden on both patients and their providers. Secondly, it strongly correlates with overall quality of life and risk for hospitalization. If you take a look at the graph, you'll see that patients with a higher WMI score, 2 or more, had significantly higher rates of hospitalization than patients who report 0 or 1. The WMI is based on scientific studies that show its use can improve care and is more strongly associated with quality of life than other factors we know about patients, like their diagnoses. And lastly, it can be done as a simple form on paper or as part of an online survey. With generous support from Blue Cross Blue Shield, White River Family Practice decided to use the WMI. This was despite the fact that we were not certain about how it might fit with so much changing around us during the pandemic. We implemented the WMI in 2 different ways. First, our care coordinating nurse routinely contacts newly discharged patients from either the emergency room or the hospital by phone. So we asked her to ask the 5 questions. For a population of 94 of our patients, they did the WMI over the phone. Second, we collected information from our face-to-face office visits for patients who came in with either chronic conditions or for a wellness exam. And these patients completed a paper version of the WMI in the waiting room or the exam room. So we got information from about 371 patients that way. Here are the characteristics of both the recently discharged and the pre-scheduled patient population. The participating patients were generally female and older. Fewer than 20% were below the age of 50. As expected, the average number of subsequent emergency room or hospital visits during the next 4 months was much higher for the recently discharged patients. But for all patients, there was subsequently costly encounters which were very strongly associated with the patient's WMI. For both our recently discharged patients and our pre-scheduled patients, as the WMI increased, so did costly care. And this provides a real opportunity. If we can intervene meaningfully with these higher WMI patients, we can improve health and reduce costly care, which is a goal shared by patients, practices, and payers. This is another really interesting graph, And what this shows is it shows for patients who had a WMI score of 2 or higher, what actually drove that score up. And the most frequent response is that is that their number of medications exceeded 5. So addressing issues of polypharmacy is another potential area of opportunity that we were very interested in. Fortunately, to get this information did not require a lot of effort. Just to collect it, it required an average of about 5 minutes for our care coordinating nurse on the phone. And she reported that she weaved it into some of the other typical questions that she asked newly discharged patients. For patients who completed the 5-item survey in the waiting room or the examining room, it seemed exceedingly brief. It was estimated it took them less than 2 minutes and was introduced by other office staff. The most telling thing for me as a provider is that I did not have a single patient complain about filling out the WMI. So, what else did we learn, and what are the next steps? We learned that collecting the WMI information was easy, and it was very acceptable to patients and to staff members. What was difficult was finding a place to put it in the electronic health record where it could be retrieved and analyzed. Our conclusion is that an automated system is preferable. And fortunately, How's Your Health website does provide a way to collect and analyze data from the quick checkup, which is the WMI, or for the full checkup. It also provides a summary for patients to share with their providers and suggested resources to help patients take actions on their own. And this website can be customized to ensure that the resources listed are local and specific and best suited for patients in Vermont. The goal is to empower patients to help themselves and to free up provider time to ensure offices are not overwhelmed. An automated How's Your Health can also help offices learn more about what exactly it is that patients want or need from their care. Again, such as that focus on polypharmacy. So we see as a next step working with other Blue Cross Blue Shield practices with the support of Blue Cross Blue Shield to really work on How's Your Health and to customize it for our area. Another thing to think about as far as where this goes is that a subsequent study across several Blue Cross Blue Shield practices over about an 18-month period could show that this approach caused a reduction in costly care, higher quality ratings, improved health confidence, and improved quality of life. With the continued support of Blue Cross Blue Shield, for which again we are very grateful, and with the input and ideas from other practices, and with the guidance from patients, we feel that we can make a real difference in the kind of care patients are getting to ensure that it really is meeting their needs.